It's a pleasure to be here to speak on the impact of the gut microbiome on nutritional health in older adults. So, just to mention my disclosures, I'm funded by the National Institute of Health Research and obviously Nestlé. Thanks for inviting me to speak today. And what am I going to cover? I'm going to cover what the microbiome is, why does it matter? And I thought a way of doing that is taking through some specific dietary examples to really show this sort of relationship between the microbiome, the host, and our nutrition. I'm going to talk about aging, frailty, and the microbiome, and specifically other age-related factors that we don't always think about that might influence these microbiome-nutrient interactions. And finally, I'm going to talk about targeting the gut microbiome to see if we can ameliorate age-associated morbidity in quite a holistic way, hopefully. So firstly, what is the gut microbiome? Well, it's this ecosystem of trillions of microbes that live within our intestines. And it includes bacteria, fungi, viruses, all of these little microbes that are in there. And we also need to think about the metabolome, which encompasses all the metabolites, those that are produced by the microbes, but also those that are present for any other reason. And this sort of combined microbiome and metabolome, many have argued that it should be considered as an intrinsic, as an organ in its own right, because of the important roles it plays in digestion, in metabolism, immune function, and in many other important bodily processes. This microbiome and metabolome are dynamic, they're responsive to diet and lifestyle, they're influenced by all of these different things that we do, including medications and acute stress states like inflammation or things like a burn injury. My colleague, Professor Claire Steeves, often talks about this idea of a garden. I think it's quite a helpful way to think about the microbiome as this garden within us that we actually need to look after and look after like we would our own actual gardens. And if you see this one on the left there, you can see that it looks a bit sad. It's got low diversity levels. It looks neglected and it needs a bit of love. And this garden on the right is much happier. It's much more diverse. It's got a whole range of different flowers and plants. And continuing with this metaphor of a garden, you can think about prebiotics and probiotics. So a prebiotic can be thought of as like a fertilizer, which feeds the garden and feeds the microbes there with fibers. And a probiotic can be thought of as planting new seeds and new bacteria into the garden. And while everyone's microbiome and everyone's microbial garden is unique, we do know that generally this idea of diversity is associated with much more diversity being associated with a much healthier microbiome. And this slide is from a paper that colleagues of mine published in the BMJ a couple of years back. But it's just really to give an indication of the myriad ways in which the gut microbiome has been implicated and associated with various disease and health states. And this slide, obviously, the paper is a little bit old now, so you can imagine that there's already a more updated version of this, which has more and more arrows coming off. And it's this growing area in which the gut microbiome is becoming more and more implicated, and we're understanding more and more the role it's potentially playing in all of these various processes. And so I thought I'd pick out a couple of dietary examples to take you through, which hopefully will sort of illustrate this, importance of the microbiome in our relationship between the nutrients that we take in and our sort of homeostasis. So, for example, the dietary fibers, we cannot break down fibers on our own, and the microbes within our microbiome do that for us. They provide this essential capacity to ferment these substrates, and that supports the growth of microbes that produce short-chain fatty acids like butyrate. I've heard butyrate described as a pivotal inhibitor of unhealthy aging, and I've just laid out some of the key features of butyrate that make it such an important uh, substance within our bodies that we need. So it's the main energy source for human colonocytes. It can induce apoptosis of colon cancer cells. It's essential for the oxygen balance within our guts. It plays a really key role in appetite control via the gut hormones and the gut-brain axis. It can activate intestinal gluconeogenesis, and it has beneficial effects on glucose and energy homeostasis. So we know that higher production of butyrate correlates with lower obesity and reduced insulin resistance. So when it's playing such an important role with energy homeostasis and insulin resistance, of course, that then has a knock-on effect on our risk of vascular disease, cardiovascular disease, metabolic syndrome, diabetes, and so on. So it's highly consequential. And the microbiome is at the heart of this relationship between our homeostatic balance, between our nutrition and our health. So the second example I wanted to just touch on was dietary protein. So the protein that makes it to the colon is broken down by microbial proteases to peptides and amino acids. Now, these amino acids can then be assimilated or fermented by the microbes to produce a range of end products. So again, you've got short-chain fatty acids like butyrate that I mentioned, but also a range of other end products. And not all of these end products are health benefits. Ammonia, for example, we don't want excessive amounts of that. So there's a balance that has to be struck. And we know that more protein will shift your microbiome. We also know that different protein sources can have different effects on the microbiome. Now, we know older people require a higher recommended daily intake of protein to overcome this concept of anabolic resistance. So I thought I'd just touch on that for a moment. So anabolic resistance is whereby older adults require a higher bolus of protein in order to achieve the same anabolic response as a younger person in their muscles. And it's thought to be one of the key contributors to why older people develop sarcopenia. Now, sarcopenia is sort of the bedrock of physical frailty and associated with higher healthcare costs, longer hospital stays, mortality, morbidity. And when you look at the various mechanisms and etiologies in the literature proposed for anabolic resistance, many of these are also processes in which the gut microbiome plays a really key role. And these are direct effects like lipopolysaccharide modulation, short-chain fatty acid production, and gut barrier function, but also a whole range of indirect effects like insulin resistance, impaired autophagy, inflammation, and mitochondrial dysfunction. And so I can imagine there's probably a version of this slide where you remove anabolic resistance and can put in there any range of different bodily processes of which are important in aging. And you would find that there's interactions with the gut microbiome both directly and indirectly. And I think we're really just getting to know all of these various ways in which it's important. So thirdly, I thought I'd touch on one of the vitamins. The microbes can produce vitamins, including vitamin K, vitamin B vitamins like folate. Folate is obviously crucial in our 1-carbon pathways, our DNA synthesis and amino acid metabolism. And we know that folate deficiency is common in older people. Up to a third of inpatients have been found to be deficient in folate. And it's been implicated in a whole range of conditions: depression, cognitive decline, cardiovascular disease, osteoporosis, and colorectal cancer. And while humans cannot synthesize folic acid themselves, certain microbes can. So lactobacillus, bifidobacterium can produce this folate, which adds to our host folate pool. And indeed, there's a bidirectional thing going on because also the microbes need the exogenous folate from diet for their own DNA synthesis. And the point of this is really just to highlight this bidirectional relationship between these microbes. We're not really separate from them. It's a constant flow in both directions of this relationship between us and the microbes within us in the sort of management of our homeostasis. So what happens to the gut microbiome as we age? So this graph over on the far right really is just to show that actually our gut microbiome is relatively stable for most of adulthood. I mean, most people, it will stay very stable. And it's only as you get into older age that it really starts to vary a lot more. And that's important. That could be kind of in the 70s, depending on each individual. But what happens then is you tend to get a reduction in diversity. And what you also get is an increase of inter-individual variability. So our microbes become more unique compared to others. And that can mean that really we might need to think about more personalized approaches to older people as these changes happen. You get reduced diversity. You also get loss of beneficial taxa. So important bacteria like Faecobacterium paranitzii, which is an anti-inflammatory anaerobe, which is also associated with the production of that all-important short-chain fatty acid butyrate. You can get increased amounts of sort of bad bugs like enterobacteria, which can be associated with inflammation. And you can get this inflammatory, inflammaging state, which can lead to loosening of the gut barrier junctions and get this concept of a leaky gut, whereby you have metabolites like lipopolysaccharides crossing across this leaky gut and leading to systemic inflammation. But why does it change as we age? Well, there are intrinsic sort of physiological changes with age that are contributing to this, but there's also these range of other kind of factors that are very commonly age associated. And I wanted to go through these in turn. So I thought I'd just make up a case study just to illustrate, because I think you'll agree that we would see a lot of these different things in our general clinical practice. So a 79-year-old man with Parkinson's disease, who also has a history of asthma, high cholesterol, GORD, and osteoporosis. He takes a levodopa drug for his Parkinson's. He's also on a statin, a PPI, some PRN inhalers, and a bisphosphonate for his osteoporosis. Recently, he's found his appetite has reduced and he's been having constipation. And he had a fall about 6 months ago where he fell down the stairs, and that's really changed his mobility. He now has a fear of falling. He leaves the house a lot less, and he's less social. So keep that case study in mind as I go through these next factors, because I think you can see that every one of the factors mentioned is something that will potentially impact on the microbiome. And as like all things in aging, it's multifactorial. So firstly, chronic disease and comorbidities. So these conditions on the right are all conditions in which there's already been evidence for clear associations with changes in the microbiome. And of course, there may also be changes associated with medications that are for these conditions, and also behavioral changes that may come with these conditions. And they'll all be interplaying, and again, multifactorial. With things like for colorectal cancer, for example, specific microbes have been identified in the tumor microbiome. And there's also been associations found between the microbiome and the responsiveness of the cancer to checkpoint immunotherapy. So it can be really consequential in these conditions. Polypharmacy is so common in our older patients. PPIs, very commonly used, metformin, very commonly used. Antibiotics, of course, are really consequential for the microbiome. And again, all of these drugs, also there's going to be downstream metabolites of the drugs, which may also have an impact. And that's something that we're really only in our infancy of starting to understand. Then in terms of this sort of immunosenescence, this ongoing inflammaging, this is really consequential and important for the microbiome. We know from Drosophila models that this intestinal dysbiosis not only precedes but actually predicts the onset of age-related intestinal barrier dysfunction, systemic immune activation, and indeed mortality of the organism. And I think what's really interesting is what we get from the animal fecal transplant studies. That when you transplant microbes from young to old, you get a longer lifespan, which is fascinating. But in those studies, they also were able to show that B and T cells were implicated, which implies that the immune system was playing a key role there. And indeed, when they go and transplant from old to young, they're able to replicate this systemic low-grade inflammation. And the important thing about those transplant studies is that implies causality, which is really interesting, and also shows the importance of the gut microbiome going forward in terms of thinking about therapeutics. Finally, just to cover sort of other factors associated with age, which are more behavioral or social. We know that it's very common for smell and taste to change with age. Dentition can be changed with age. There's a talk earlier on the oral health associated with aging and how common it is to have gum disease. You can have changes in swallow and in gut motility, which will also be implicated in the gut microbiome. And importantly, things like human contact. So we know that this concept of the social microbiome, so the more people that you spend time with, the more social you are, the more diverse your gut microbiome tends to be. And as you spend more time alone, that can be associated with reduced diversity. And household pets are also vectors for sharing of microbes. We think of sharing of microbes after COVID as always a bad thing, but actually it can be a positive thing to share microbes within a household, and that can be associated with more diversity. So it's not always a negative thing. And then things like physical activity. So the more sedentary you are, that will impact the gut microbiome, but it will also impact things like gut transit time. And thinking back to our case study, he was less social, less mobile, and all of those things will have an influence. All of these factors. So really, it's just to sort of illustrate the myriad of ways in which the gut microbiome and the host are interacting at all the time. But all of these age-associated factors, all of these factors I've gone through are more common in aging, and therefore more likely to impact the gut microbiome. And if you think back to that earlier slide where that stability gets lost, all of these will be influencing that change in stability that happens as we get towards our 70s and 80s, depending on each individual. So what about frailty in the gut microbiome? Well, you do get this reduced diversity with frailty that we do tend to see with aging. This was a very nice paper done by the EuGMS study, which was from Cork. Over on the right, the red dots were those that were living in a care home, and the green dots were those people that were living in the community. And you can just see the clear separation in terms of gut microbiome sort of signatures in terms of composition. And there was a huge shift in when people moved into a care home in terms of their microbiome. But there's also really specific taxa that have been shown. So colleagues of mine published this paper in genome medicine, they showed that FPRO is really specifically associated with frailty. Um, it's that you want more of it rather than less of it. So less of it is associated with frailty. It's got anti-inflammatory properties. And it just makes you think about, well, if we could come up with a way of replacing that, what influence would that have on frailty? And I just think it's quite an interesting thing to think about. But what can we do to influence it? And I think that's the key thing about the gut microbiome is that it's malleable and we actually can influence it from the outside, which is quite exciting because for a lot of the issues that we deal with in geriatric medicine, we don't have good therapeutic options. For example, sarcopenia, there's no licensed pharmacotherapy nor is there for frailty. But there are lots of ways in which we can influence it. So I'll go through these. Firstly, thinking about diet. So high fiber diets will be associated with higher diversity, with more short chain fatty acid production, and with lower rates of inflammation. So things like fruits, vegetables, and whole grains. Fermented foods are associated with a healthier microbiome, introducing new positive microbes. The Mediterranean diet, which we all know is so positive for aging. Well, they've done some neat work on this from the New Age Mediterranean diet intervention. They profiled the gut microbiome of over 1,200 of the participants, comparing the frail patients with the non-frail. And they were able to show that there were really specific gut microbiome changes which were associated with reduced frailty, improved cognition. They had reduced levels of CRP and interleukin-6. And even these associations were there after adjusting for a broad range of confounders. So thinking then about sort of comparing this sort of prudent or Mediterranean diet to a Western diet, when you have this healthier diet, when you're getting high dietary fiber, naturally occurring prebiotics in your diet, you get the production of those nice short-chain fatty acids that are so valuable. With that, you get this neatly regulated immune response and up-regulated tight junctions of the gut barrier. And then you get this functional barrier, which keeps everything as it should be and is not letting things leak through. However, if you compare that then to the Western diet, where there's high fat, high sugar, there's emulsifiers and lots of processed foods, you then get deregulation of this immune response, downregulated junctions, and the dysfunctional barrier with things going across that shouldn't be going across, leading to systemic inflammation and being associated with chronic disease. But what about prebiotics? Prebiotics are basically fibers that stimulate the growth of beneficial bacteria and confer a host benefit for health. So that's the definition. These are things like inulin or FOS or GOS. FOS is a fructoooligosaccharide and GOS is a galactoooligosaccharide. These are really already commercially available, cheap and low risk. The main side effect of prebiotics is that you might get some flatulence. So they're really low-hanging fruit in terms of the risk of suggesting them to patients. And I thought I'd just list off some of the evidence that we have for some of the benefits of prebiotics. So they've been shown to improve gut barrier function, reduce this gut permeability and systemic and subsequent systemic inflammation. We know that they're associated with increased production of these important anti-inflammatory short-chain fatty acids. They've evidence of improving metabolic health by enhancing insulin sensitivity, lowering cholesterol, and reducing our fasting glucose levels. But it's not all local effects. They also have downstream effects that people don't always think about. So things like enhancing calcium and magnesium absorption, which has a knock-on effect on bone density and the risk of osteoporosis in postmenopausal women. And there's been some nice studies showing that prebiotic supplementation in older adults can improve hand grip strength, fatigue levels, and overall frailty index. And hand grip strength and fatigue levels are both measures of the frailty phenotype. So we might not think of prebiotics as being a potential therapeutic for frailty, but there is a growing body of evidence there of this idea of the gut-muscle axis. And I ran a study myself looking at a prebiotic in a randomized controlled trial, which was published in Nature Communications last year. And we were able to show quite neatly that a short 12-week intervention of a simple, commercially available prebiotic in older adults was able to improve cognition versus placebo. And again, was very well tolerated. So these are cheap, well-tolerated, simple interventions that might have quite a holistic benefit for our patients. What about probiotics? So these are live microorganisms, which again, the definition is that they confer a health benefit on the host. And these have also been associated with a range of different health benefits. So they can reduce antibiotic-associated diarrhea. They can be positive for constipation. Interestingly, there's evidence that administering a probiotic is associated with a stronger response to the influenza vaccine. And also, there's been 2 or 3 different papers showing reduced duration of and less severe upper respiratory tract infections. So they have this important role in immune function. There's also another study showing preserved natural killer cell activity versus placebo. Similarly to prebiotics, there's evidence of them improving cognition and reductions in stress, and also reductions in age-associated bone loss. And then finally, again, this gut muscle axis, which is a really interesting growing area, showing that probiotics can improve muscle mass and strength. So again, these are obviously, you can get probiotics in diet and they're also available in supplement form, but they're well tolerated, simple interventions. And this is just a nice summary slide that was in a paper a couple of years ago, just showing summary of the main health effects that have been attributed to pre and probiotics in older people. And again, it's only been a couple of years since this came out, but I think these arrows will just continue to grow on this slide as more and more evidence comes out. And the fact that they can have, effects on things like wrist bone healing, it's really interesting and really promising. Finally, I just wanted to talk a little bit about fecal transplant because there's mostly animal model evidence for that, but we know that it's highly effective in C. diff infection, and that's maybe where most of you will have seen it. There's also some growing evidence in hepatic encephalopathy and also in treatment of quite severe constipation. But a lot of the evidence does come from animal models, and the top one here is just to show some of the nice studies that have been done in mice, where they've shown that when you transplant from young to old mice, you get increased physical fitness, longer health span, and longer lifespan. And you also get a reduction of this sort of senescence-associated phenotype. And then when they transplant from old to young, they're able to show increased body mass, increased inflammation, and reduce function of the central nervous system. So again, there's showing some causality there, and that's what's really promising. The second slide, the second part of the graph there is just to show that when they've shown fecal transplant studies from longer-lived species to shorter-lived species, so from humans to mice, that they have been also able to show some positive impact on the shorter-lived species. So it's a really exciting area for the future, although it does sometimes fall between two stools in terms of trying to get ethical approval, because it's not always clear if it's a food or a drug or where exactly feces sits in terms of an intervention. So my take-home messages is that really the gut microbiome plays a crucial role in our host-nutrient interactions, and I've only been able to cover a small selection of examples because there's just so many, but I thought going through those would hopefully be illustrative. That aging and frailty really do affect the gut microbiome composition and diversity, and that as we get this increased inter-individual variation with age, that more personalized approaches are likely to be needed, but there are probably still ways in which we can think about things on a population level too. The gut microbiome is malleable. It can be influenced by really simple measures such as dietary changes, pre or probiotics, and therefore it really holds huge potential as a malleable therapeutic target in older population to improve health span and independence. And I think as geriatricians, we do think about our patients holistically, and they have the potential to have this holistic benefit through a whole range of different bodily processes just by targeting the gut microbiome. And these are just some of my references. So I just say thanks and welcome any questions.